You're listening to the Quint's podcast.
कोविड वॉरियर्स जेन्युइन डिमांड जो है हमारी, हमें नहीं चाहिए फूल बरसाओं पे। हमारी जेन्युइन जो डिमांड है टू एक्सपेडाइट द नीट पीजी काउंसलिंग, बस वही करा दे, वही हमारी बस मांग है गवर्नमेंट।
If there are not adequate doctors, then how will we treat our patients? This is a pandemic, for God's sake.
Protests and sloganeering by resident doctors from across medical colleges and hospitals in Delhi have been reverberating for the past month over the delay in the NEET PG counselling. And the reason why this counselling process is so important is because nearly 44,000 doctors, which are assigned by the counselling process every year, have been left in a lurch for almost 12 months now. And with no new staff, only 2/3 of resident doctors have been available at government and state-run hospitals, that too in a pandemic. And on 27 December, a protest by the Federation of Resident Doctors Association, or FORDA, near the ITO post office in New Delhi met with a wall of police personnel, where videos shared on social media show the police dragging and detaining several doctors. Over 100 doctors were detained, and the police also filed an FIR on charges of rioting and destruction of public property. According to FORDA, the protest will continue until the demands have been met. For today's episode, you'll hear from resident doctors part of the protest from Safdarjung and Pant hospitals in Delhi. You'll also hear from Dr. Suvrankar Datta, who is a junior resident at AIIMS Hospital Delhi and the General Secretary of the Federation of All India Medical Association. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. Resident doctors from hospitals across the capital like Safdarjung, RML, Hindurao, Kasturba and Loknayak and many more have suspended their services over the NEET PG counselling delays. And in the wake of a rising fear of a third wave of COVID-19 due to the Omicron variant, these doctors have started protesting, claiming that they are severely overworked and burned out. To understand this, the Quint spoke to several doctors present at a protest at Safdarjung Hospital. Dr. Lovely Singh, a gynecologist at Safdarjung Hospital, recounts an incident where she had completed a 24-hour shift in the emergency ward with little to no sleep and had no one to replace her.
Once I was supposed to assess a case in OT. I was post duty. I was 24 hours. I had 24 hours emergency duty, and I had not even 2 minutes sleep. Okay, and so I was really tired, but nobody was there to replace me in the OT. So on that day, I was like kind of sleepy. So what will you say if a resident who is doing an operation is sleeping on table? What do you think that how will that affect that patient who is on the table?
Dr. Mahesh Mahajan, a neurosurgery resident at GB Pant Hospital, adds that the lack of manpower has a cascading effect on the entire hospital, since responsibilities are further divided and the already stretched staff gets burdened more.
एक स्ट्रेटा रहता है, फर्स्ट ईयर, सेकंड ईयर, थर्ड ईयर, देन लेक्चरर, असिस्टेंट प्रोफेसर, एसोसिएट, देन प्रोफेसर. तो अगर फर्स्ट ईयर नहीं तो ऑब्वियसली फर्स्ट ईयर का वर्क सेकंड ईयर एंड थर्ड ईयर में डिस्ट्रीब्यूट हो जाएगा. ठीक है, जो ड्यूटी आवर्स होंगे वो स्ट्रेच आउट हो जाएंगे. ऑब्वियसली किसी अस्पताल की अगर कैपेसिटी 100 होती तो आपको भी पता है इंडिया में जिस अस्पताल की कैपेसिटी 100 होती है उसमें मोर देन 150 पेशेंट्स रहते हैं. काफी सारे अस्पताल में फ्लोर बेड भी रहते हैं. तो अगर 100 पेशेंट्स के लिए मान लो 20 डॉक्टर असाइंड है और वहां पे बस 10 ही डॉक्टर काम कर रहे हैं कि जो 150 पेशेंट को सर्व करे, तो ऑब्वियसली वहां पे मिसमैनेजमेंट होगा, और मिसमैनेजमेंट अगर होगा तो फिर उंगली किस पे उठाई जाएगी? ऑब्वियसली डॉक्टर.
So if this process is so crucial to India's healthcare system, why has it been delayed for nearly a year now? All the answers lead to a clutch of cases in the Supreme Court over a new reservation policy which the centre introduced in July. But before we dive into that, a quick recap of why the counselling process has been delayed so far. Now, the NEET PG exam, which is usually held in January each year, was first delayed in view of the pandemic and was supposed to be held in April this year. It then got further delayed due to the second wave and was finally held in September this year, but the results have not been declared yet. And that is due to a new reservation policy introduced by the centre for the economically weaker section, or EWS category, for the current academic year. While the reservation was welcomed by many, the decision to set the limit of Rs 8 lakh annual income fixed for determining the EWS category was appealed in the Supreme Court by a clutch of petitions. Now, this further led to the Apex Court directing the centre to put a hold on the counselling until it determines the validity of this decision. And an answer by the Ministry of Social Affairs was supposed to come at a hearing on 25th November. But the ministry stated in that hearing that it will require 4 more weeks to file the report, and the case was further pushed to 6 January 2022. And around the same time as the hearing, the most mutated variant of COVID-19, Omicron, was also detected in South Africa, sparking fears of a third wave in India. According to Dr. Safdarjung Datta, the General Secretary of the Federation of All India Medical Association, this was the point at which resident doctors across the capital and India decided to resort to protest to shed light on the state of the healthcare system in India.
But however, the government's advocate, they asked for 4 weeks more time to justify their policy. And that was the one actually the point of time when all the doctors all across the country were eagerly waiting, because see, in the last 2 COVID waves, we have been thoroughly exhausted and we have been overworked with working just with 2/3 of the number of workforce who are actually supposed to be there. So at that point of time, doctors decided this is enough. Now we have to compel the government to fast forward the process and get the counselling schedule out. So this was almost 1 month. We have been protesting in various ways. There have been multiple deliberations with the ministries, both the health ministry as well as the Ministry of Social Justice and Empowerment, under whom the EWS committee was formed. But unfortunately, there has not been any kind of response. Promises were made, but the government and the ministries went back on their promises. And right now, we are all well aware what happened 2 days back when our colleagues were brutally manhandled by the Delhi police. And that was the reason why all stations all across the country have decided to come in and join in the protest by complete withdrawal from all services.
Dr. Datta adds that the significant burnout of doctors has already led to several people resigning and some even committing suicide.
NEET PG is the one through which maximum amount of doctors, almost 40,000 doctors, are recruited. And these are the state colleges where there is no cap in the number of patients. The number of patients, whoever comes, we have to see them and we have to give them our service. Because if we don't give, who else will give? So an already historically overburdened system in India, and they don't have enough healthcare infrastructure and manpower to cater to the current number of patients, even with the adequate number of people. And with just 2/3 of the workforce, it has led to a significant physician burnout. People have resigned from the residencies after studying so hard. They have joined the residencies because of the pressure. People have resigned. There have been suicides, and a lot of things have happened. And this is high time that the government should have expedited the process, but instead they again delayed the counselling. So that is not acceptable at all.
With the detention of hundreds of doctors by the Delhi police on 27 December, the call to expedite the counselling process got ignited further, with the support now from netizens and politicians. Reacting to videos of police personnel detaining protesting doctors, senior Congress leader Rahul Gandhi tweeted in Hindi saying, quote, "Showering flowers was a PR act. In reality, injustice is what is raining down." End quote. Delhi Chief Minister Arvind Kejriwal also took to Twitter, sharing a letter that he sent to the Prime Minister to expedite the counselling process. And late on 28 December evening, Union Health Minister Mansukh Mandavia held a meeting with a delegation of protesting resident doctors and urged them to call off their strike to the larger interest of the public. The minister stated that the centre is unable to conduct the counselling since the matter is sub judice before the Supreme Court, and that the government will submit a reply to the Apex Court before the scheduled hearing in January. However, the Federation of Doctors Association on 29 December stated that the protest is still underway and have listed 3 demands. First, to ensure that a date of counselling is announced after the January hearing. Second, a written apology by the Delhi police. And third, withdrawal of the FIR lodged against protesters. Dr. Aarti Parashe, a resident doctor at GP Pant Hospital in New Delhi, says that even though doctors are overburdened, they will ensure that medical service is delivered to patients, but is unsure if it would be quality service.
We have seen lot of deaths in front of us. Mentally and physically we are tortured. लेकिन still हमने exhausted होकर भी काम किया. अगर हम overburden काम कर रहे हैं, so we can assure the treatment to the patient, but we cannot assure the quality of the treatment to the patient. नहीं था, अब वो भी नहीं है. कल DGHS आए, उन्होंने बोला कि he is not sure कि 6 तारीख को काउंसलिंग के बाद भी कुछ होना है कि नहीं होना है. चार्जशीट जो कमेटी बिठाई गई थी उसका भी कुछ होगा कि नहीं होगा, उन्होंने बिल्कुल कुछ ऐसा एश्योरेंस नहीं दिया है। तो हम ये जो और उसके ऊपर जो ये कल जो ये ब्रूटली हैरेस चीजें हुई हैं, दिस इज वेरी अनथॉटफुल, अनथिंकेबल कि डॉक्टर्स के साथ ऐसा कुछ होगा। तो आई डोंट थिंक सो। अगर गवर्नमेंट की तरफ से सुनवाई नहीं होगी तो हम ये अपनी प्रोटेस्ट कंटिन्यू करेंगे।
Over the past month, the Quint has covered the doctors' protest from the ground, and you'll find a link to our ground reports in our show notes. You can also play an active role in shaping our journalism by becoming a member of the Quint. You'll find details of that in our show notes as well. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.